Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Good afternoon, everybody. Thank you for joining us for this live webinar where we will be discussing private duty benefits for veterans and where home care organizations and veterans can find the funding needed to cover care services in the home. My name's Samantha Mills. I'm on the marketing team here at Axxess. We're a leading home health care technology company offering a complete suite of easy-to-use, innovative software solutions, empowering home health, home care, and hospice providers to grow their business while making lives better. Today, you will hear from industry expert Tammy Ross, Senior Vice President of Professional Services here at Axxess. She leads a team of professionals whose goal is to provide education as well as practical and operational solutions for care in the home organizations. And she will be speaking with our two esteemed guests, retired Air Force Colonel Larry Rice and retired Air Force Colonel Terry Ross, to whom we are very thankful for their service as well as their time to be here with us today. So before we get started, just a couple of housekeeping items. Everyone's phones are muted. However, you may submit questions throughout the webinar. And if time permits, Tammy will answer questions, as many questions as possible at the end of the webinar. And if we don't have time to answer questions at the end, we will be following up with you if you have any questions after the webinar. And also following the webinar, we will provide everyone with a link to the slides as well as the video recording of the webinar on our website. So I will hand it over to Tammy.
All right, thanks, Samantha. I'm happy to be here today and very happy that we have Colonel Rice and Colonel Ross. Hi, Samantha, thank you. And we're looking forward to the presentation today. Happy to be sitting here with Colonel Rice and Colonel Ross. And we'll get this webinar started. Let's just first introduce the fact and the reason we're here. There's about 20 million veterans in the United States now. About 30% of those have multiple chronic conditions. And those chronic conditions can be managed a lot by private duty health care. Most veterans and private duty organizations are unaware of the funding sources available to pay for this care. So we hope as you go through this webinar that you're going to learn funding sources and you're going to be able to help our veterans in need. So today we're going to explore demographic facts of veterans. We're also going to look at considerations for care. We'll also understand the various funding sources, and there's a lot. I was actually shocked when we started getting all this together at how many funding sources is out there. And then we're going to explore resources for end-of-life care because we know that about 1 in 4 people on hospice now are also veterans. I'll start us off and we'll get going on some demographics here. So private duty, I don't have to tell you guys that private duty is growing by leaps and bounds. About 10,000 Americans become eligible for Medicare every day. That's 3.6 million a year who are older and sicker and have multiple costly chronic conditions. What else is happening as we look at that is the fact that Medicare is running out of funding. We're seeing a big shift from Medicare Traditional to Medicare Advantage. And the reason for that is we have to find more economical ways to care for these patients. And a way of doing that is through private duty care. $4 trillion is spent currently on the national health care. We expect that to go to $5 trillion in 2025. And our average nurse is 50 plus years old. The reason I mention this is that we're aging. I am a nurse by trade. We're aging at the rate our population is aging. And by 2030, about 20% of us are going to be over the age of 65. To put it quite frankly, there's not enough nurses to take care of the patients unless we adjunct that with private duty. As we look at transitional care, that's that care when someone's moving from one care environment to another. About 40% of patients, including our veterans, are discharged from the hospital with home health instructions. They never receive any home health care. Why is that? Sometimes the insurance doesn't pay for it. Sometimes they don't meet the conditions for home health care, such as having to be homebound. Sometimes they don't meet the conditions for hospice, such as a terminal diagnosis. That's about $2.5 billion in revenue annually that's unrecognized and unclaimed. 70% of those patients over 65 would rather age at home than age in an institution. And that makes sense, especially when we're in this pandemic world we're in now. We know folks would rather be at home where they feel safe and that they're protected from infections and quite frankly, the quality of care in the home, no matter what, they're going to be more comfortable. Our home care market, which is our private duty market, is expected to grow to $187 billion in 2026. So that's quite a growth. And we think that it could be even larger if we target that veterans population. Look at some of these demographics. 180,000 Americans enlist in the United States Armed Forces each year. Our populations for veteran is close to 20 million now. And over 65 is 12.4 million. That's a significant amount of people that most likely have one or more chronic conditions. When we look at those veterans, 11% of those over 65 have some type of depression. It's twice the national average. I mentioned that here because anybody that has depression is going to have slower healing times. It's going to exacerbate all the other conditions combined. So that depression plays a huge role. 30%, as I mentioned before, have more than one chronic condition. So when you put all that together, you can see that our veterans population is ripe for private duty, being able to move in and assist them with some of these needs. So I put a few of those together for you to look at here. What are some service lines when we think about private duty? Obviously, at the very top is our private attendant services known as PAS. Those are the services that provide activities of daily living for our veterans. This is assistance with bathing, dressing, meals, feeding meals, all those type of things, toileting. And we know that this is a huge need. Also, transitional care. If you've ever been sick and been in the hospital lately, or been in any type of medical, I'll call it a medical crisis or a medical new condition being diagnosed, you know that there's a lot of hoops you have to go through. So being able to transition that and understand about the pharmacy, understand about home health benefits, understand about private duty benefits, what pays for what. That's a service all in itself. And we'll talk a little bit about care navigators. That's a subspecialty of private duty and how important they are for veterans in a few slides over. Rehab, many of our veterans come back with lost limbs, damaged limbs, decreased ability for mobility. So having rehab aides that are specially trained to deliver exercise for these veterans, maybe to carry out a home exercise program, especially important. Home maintenance and home adaptations. Again, I mentioned, the amputation and the decreased functional ability. So a lot of our homes need to be adapted for the care in the home, whether that's a wheelchair ramp, whether that's a walk-in shower, a handheld shower head, rails in the hallways. There's a lot of adaptations that happen to care for someone in the home. Believe it or not, if you try to call that handyman now, you're probably not going to find them. Someone told us along the way that everybody had to have a college education, so nobody is actually going into those important trades anymore. So it's very, very difficult to get that kind of care unless it's done under a company, under a service. There's no reason that private duty couldn't do that. Care coordination, it's kind of like that transitional care. It's navigating all of those areas for our veterans. That's going to be huge. We need to be able to navigate and help them navigate. Some of you guys are familiar with geriatric care managers. I could coin a word, veterans care managers, people that specialize in veterans care, whether that's a social worker or nurse or someone that's especially trained to know how to navigate the VA. We were talking just prior to this webinar about how hard it can be to navigate veterans benefits. You hear one thing from one person, you hear another thing from another person, and you really don't know what to believe. Maybe the customer service person at the VA doesn't give you the correct information or the full information. So these veterans care coordinators could be a huge benefit for private duty. Hospice, those individuals that have 6 months or less to live, 1 in 4 are veterans. We'll talk about a special program in a minute that's completely geared to hospice patients that are veterans. But certainly private duty services have an attendants that understand palliative care and understand the psychosocial implications of hospice care would be important. And the last one I'll mention is cognition. Many of our veterans come back and from wartime with PTSD, post-traumatic stress syndrome. This cognition, this emotional problem can affect their cognition. It can affect the way they think. It can affect the way they handle daily circumstances. It can even lead to dementia if you read many of the articles that are out today. So having aides that can help these folks practice and actually work with them on cognition skills, extremely important. So let's take a look and start discussing some funding sources for our veterans. I mentioned a lot of needs, and this is generally what we find as a private duty organization. We go in and we see someone in need. Maybe we get a referral from the gentleman on the right here, and guess what? There's no funding available. It is truly counting out money out of the money jar or change out of the change jar just to be able to pay for some of his basic care. So, Colonel Ross, I'll start the first question to you. I know there's disability available to veterans, and I know this could be a funding source. Can you talk to us a little bit about that?
Sure. One of the things about veterans I might mention is that veterans come in all shapes and sizes. And what I mean by that is there's veterans that serve anywhere from 1 year or a 4-year tour of duty to all the way to retiring over 30 years, and some even up to 40 years of service. So they're going to have different needs and different conditions that come up. But one of the things that's common to all is they're entitled to disability. And what we're talking about is if either an injury or a wound or an illness of some type develops during their tour of service in the military, they call it service-connected disability that occurs there, then they're entitled to compensation for that disability. And basically what it does, it takes it in 10% increments all the way up to 100% disabled veteran, and it entitles them to payments. They get monthly payments based on the amount of disability. And so one of the things that you may want to consider, if somebody retired, maybe they only served 4 years and they've been away from the military for the last 50 years, and they had a service-connected disability back at the beginning. It might have only been rated out at 10%. Well, over time, that condition gets more severe. And if they can go back, they're entitled to go back to the VA and have their physicians review it and take a look at it, and they may be able to have that compensation increased. For example, if they have diabetes, that would be one of the conditions that is covered during their time. It developed while they were in their military service. And initially, they may have got 10% for that. They're just on medication or it's diet controlled and managed, but now they're on insulin. They could go up to 30 and even some, if it's more severe, 50%. It requires hospitalization. So that would obviously increase their entitlement. So encourage them to find out, do they have a disability and at what rate and when's the last time they had it updated. The other thing is the compensation can range up to over $3,000 a month. So we're talking about a significant amount of help for the veterans for their disabilities. One thing they also need to check is at the time when they retired, I know for myself, I assumed that they would include the spouse entitlement with that automatically. They did not. You have to claim that. And so when you go back, if you wait too long, you could end up, they would start the clock when you put in the new claim, but you don't get back pay for those times and periods that were missed. So maybe they could check, see if they're getting paid for a spouse or maybe a dependent child if they have somebody still living at home. And that could increase the amount they could get paid. And the last thing I'll mention on that, Tammy, on disabilities is they also have something called special military compensations. There's different letters, L, M, that go with those. Won't get into those details. But those are for loss of limb or blindness or those kind of things that add to their 100% disability. So that's on top of that, they could get an additional compensation for those types.
So Colonel Ross, is there a time limit to going back and filing for disability? What if it's been 50 years since they have served?
There's no time limit on it. The only thing is they have to have some kind of notation in their medical records before they left active duty service that this condition existed. As long as it existed while they were on duty, then they can do that. And we also have if you look at the slide, there's various agencies and activities out there. They call them VSOs, Veteran Service Organizations, that can help with that. They can go back and see what might be entitled, see what was in the original medical records and help research all that. There's a directory for those agencies. That's the first website. Also, you have the American Legion. They help as well with veterans on that research. Disabled American Veterans, the DAV, I know they've helped individuals as well. And by the way, they do this free of charge as well. I personally use the Military Order of the Purple Heart, and they're another excellent organization that will help you complete all the VA paperwork, make sure you get your submission in to request approval for the disability. Both initial and to go back and have it increased if your disabilities have gotten more severe. And then, of course, the Wounded Warrior Project as well. They're very good at helping the wounded warriors, even just for financial aid. If somebody has trouble making ends meet that's a wounded veteran, they can go back through this organization, and if approved, they can get some additional financial help.
Yeah, I actually used that website on the directory, and it was pages of VSO, several organizations, some of them even state specific. So I can see as a private duty agency, we could access this as a adjunct to our care and be able to link that veteran up with these services when they're needing more care and can't afford it. Thank you. That was a really good summary. So looking at the Gulf War, as I started looking at some statistics, I saw that the Gulf War is about 50% of all of our veterans. About 8 million veterans are actually Gulf War veterans, which are younger. Many veterans have chronic illness from this area. Can you talk to me a little bit, Colonel Rice, about presumptive diagnosis and how can that impact these disability ratings?
Sure, be glad to. One of the lessons that was learned from the Vietnam area, and in particular, some of the impacts associated with Agent Orange, was the VA wanted to start trying to get ahead of some of these chronic conditions that develop after conflicts have ended. And because of the unique features of military service, these veterans may be exposed to health risks that do not appear until after their service is complete. Certain chronic conditions associated with these risks have been identified and are medically presumed to have been caused by the veteran's service. This presumptive diagnosis enables veterans to both receive care at VA facilities for these conditions, as well as potentially receive a higher disability rating, increasing their monetary disability payments, as well as their eligibility for additional veteran support programs. Veterans are required to apply for a change to their disability rating within a year of being diagnosed with one of these conditions. And it's important to note that this is a fluid list. Obviously, medical diagnosis of suspected hazardous conditions suffered by veterans is ongoing. And the list is added to as these conditions are linked to military service. For example, one way the VA in particular is being more proactive in preemptively documenting future risks is to reduce the number of veterans having to retroactively apply. For example, the Airborne Hazards and Open Burn Pit Registry was created to allow those recently deployed to Southwest Asia to submit documentation now that will greatly aid veterans who suffer from any future chronic conditions, presumably linked to this service.
That's great. And as I looked over the Vietnam veterans list, my dad is a Vietnam veteran, and a lot of the cancer starts showing up, and he had an aplastic anemia that he was actually awarded disability for. Now, they didn't rank it. It was at a 0% because when he retired, it was under control. But we have that in case anything pops up later on. He's in his mid 70s now, closer to late 70s. So we could actually go back because we have that rating and with that presumptive diagnosis to increase his disability if needed.
Yes, this is, there's both good things and challenging things about this. On one hand, right, it's great that if subsequent to your service, the government determines that certain medical conditions were caused by that service, it gives veterans the opportunity to get that help that they wouldn't have got when they were actually discharged from active duty because it wasn't known. The flip side of that is, again, because it is a fluid list, you kind of have to keep up with that. The onus is kind of on the veteran, or in many cases, the veteran's family members and caregivers, to be able to recognize these conditions and then take action with the VA to get their disability updated. And that's what's really important, is being proactive to get that documentation submitted so the veteran is eligible to receive the additional benefits.
Great, thanks, Colonel Rice. Let's keep going with one that I just heard about, actually, Colonel Ross. In the final rule, it came out just this year, October 1st, 2020. It's called a Program of Comprehensive Assistance for Family Caregiver. Can you talk to me a little bit about that and who's eligible for that?
Sure. I'm very excited about this one because this is one of the new things in the last 3 or 4 years. Has been a big push within the VA to take a better care of our veterans when possible. And in this case, the family caregivers, the person that's left to take care of the veteran. And of course, that takes some of the burden off of the VA. So they're really looking for the families to take this on, and obviously Private Duty Act resources for them to be able to help them out. This one's called the Program of Comprehensive Assistance for the Family Caregiver. Long name to it, but bottom line, what it means is they want to try to give some help to the caregiver. And what they do, this is very interesting, it's really unique, is that they will pay the caregiver if they're over 18 years old, could be a child, could be a spouse, but it's a family member. They're going to pay them a GS4 government grade salary, step 1, which is the basic level of a GS4 employee that would work for the federal government. So they're going to pay them to be the caregiver. Now they can use those funds to hire somebody, do what they want to do themselves, or bring in a private duty activity, help them with that caregiving. And the qualifications for that is the veteran just has to be at least 70% or higher disabled to qualify. And to give you an idea, the typical veteran, if they stay at 20 years for retirement in the military career, usually come out with at least about 30% disability. That's kind of like the bottom line. So to get to 70% as they age is not out of the question. It's a normal range to get into. The other thing is they just need to need assistance with activities of daily living. And you know those better than I would, what they're listed, there's several of them listed out. If one of those activities they need help with, that would also qualify them. And the period of service they qualify for is currently, as I talked to the VA this past week, currently they're looking at the post 9/11 group. That's what went effective 1 October on the final rule. So they're going to want to be the ones eligible for this program, but they also told me that phase 2 is going to bring those veterans prior to May 7th of 1975. So in other words, Vietnam veterans and before World War II, Korea will be the next phase of the program. And then there's plans for the third phase, which will actually bring in that group in between those. So anybody, Gulf War, all those type of eras and time frame in there, so that eventually all veterans will be covered by this program, which is fantastic. And the other thing to let you know is that they have 2 levels on this. Level 1 is basically they're at the 70% disabled. If it goes on to that, unable to sustain themselves within the community, in other words, homebound, that sort of thing, then they go to level 2, and that'll get them the higher amount of pay and reimbursement for that. And so what we're talking about is approximately $2,000 a month, up to $2,000 a month, or $33,000 a year in compensation that they would be able to use as needed. So that's going to be a great source for families and the veterans and their caregivers to be able to help out the veterans with.
I just did some fast math while you were talking, and a lot of our private duty is around $20 an hour for private attendant assistance, and that's kind of in the middle. That would work out to about 32 hours of care a week, which is substantial for these families. So knowing that, and knowing that you could actually offer this to those in need is going to be huge. And we know a lot of these young men and women are going to have the traumatic brain injuries. They're going to be the amputees. They're going to have a lot of functional impairments that this program would be great at.
If I could add to that as well, one of the things on this there's on the VA website, there are actually two applications that are processed, one for the veteran to make sure they qualify, and a second one for the caregiver to actually complete to show that the caregiver qualifies as the family caregiver as well.
That's great. That's an exciting program. All right, so Colonel Ross, you had talked about disability and kind of are on that track. So I have clients currently that are getting pension funds. Is that the same as a military retirement, and can that be used for private duty services?
That's a great question. And that sometimes gets confusing. Retirement pay is what, if you retire, you spend the time, and there's several different retirement programs depending on when you came into the military service. But bottom line, if you serve 20 years or plus, usually there's some type of retirement program that the veteran will receive. That's going to be for life. That is going to be set at that amount. And it has nothing to do with their disabilities or health care or anything else. That's for their service, for their time. And then disability is for those service-connected disabilities that came on top of that. The pension program is actually a separate third track, and that one relates to primarily non-service connected disabilities. So veterans that got conditions after they retired from the military or separated from the military, and they basically are financially strapped, is what it amounts to. Veterans that just have no funding source available for health care. And so they would receive what they call a need-based benefit for those non-service connected disabilities, and it's to meet an income gap. So because of that, it is going to be a means-tested one. They're going to have to do an income test to see what kind of available income they have. They consider what you have, payments you have to make, and that sort of thing, but disposable income available, and your life expectancy. In addition to that, they're going to look at assets held. So they're going to look at everything minus home, transportation, and see if you have additional assets. And that's all going to go into a consideration as to whether they receive a pension or not. So pretty much it's for those that have no other means available to them, then the pension is a real possibility for them to receive that. The requirements for that are, though, that their service time frames, basically entered service before September 7th of 1980, and if they served at least 90 days on active duty, during that time, and at least one of those days was during wartime. So this is more of a pension's more for our wartime veterans. So one of those periods covered for wartime. Other things, they have to be at least 65 years old, have permanent or total disability. They can be either a patient in a nursing home or getting Social Security disability or supplemental security income. And again, need assistance with their daily living. And so another great source for the veterans to be able to get funds for that.
Excellent. And I'm thinking that's about $1,300. Is that about right? At least that's what my patient was receiving. And when I think about that, I would think that you would have to really balance your Medicaid funding along with that additional income that you're getting to see if that would set you above the Medicaid limit for your state.
Yes, and one of the research pieces I looked at had actually indicated that when you compare, one of the things the veterans' family is going to have to do is compare Medicaid and the VA pension to see which is going to be better. Their recommendation, if it was nursing home care, they're going to be better off going with Medicaid. In most cases, the VA pension falls more into your area, which would be the private duty care, home care, is where they think typically the pension works out to be a better route for the family to go.
Great, thank you. So I know we have some medical care benefits that are available to veterans, and we as private duty agencies need to make sure that we're accessing those medical benefits. Can you talk to us a little bit about that, Colonel Rice?
Yeah. So many veterans, as well as their caregivers and family members, are often unaware, particularly if they live in more suburban or rural areas. They can be unaware of the wide spectrum of medical care benefits that they are entitled to by nature of their service. The Veterans Health Administration operates over 1,250 healthcare facilities, including 170 full-up medical centers. These medical centers operate a wide range of services, including a lot of the traditional hospital-based services, such as surgery and critical care and pharmacies and things like that. But they also operate over 1,000 outpatient sites that provide specialty care for veterans across the spectrum of medical services. So optometry, dental, dermatology, all kinds of specialty clinics that most veterans or their families may not even be aware of. As these veterans' needs transition to long-term care, the VA provides assistance in multiple areas. First, the VA itself operates 100 nursing homes, or what they call community living centers, across the United States. Also, while not managed by the VA directly, many states operate veterans' homes as well. Many VA medical centers, furthermore, also oversee a medical foster home program where the VA inspects and approves trained caregivers to provide 24/7 care service to a few individuals. And they also provide eligibility-based support to certain veterans in adult family homes as well as assisted living facilities. And then finally, in response to an increasing need to support these caregivers, the VA has increased its respite care services, and we're going to talk a little bit more in detail about the respite care later in this presentation.
Great. Larry, is there any charge for any of this? Is there any, if you're a veteran, do you pay co-pays? How does that work?
No, as long as, for example, some of the specialty services in the medical centers, as long as you are eligible to receive VA health care, you have a disability rating or a service-connected disability. And in some cases, some of these specialty clinics, you don't even have to have a service-connected disability to take advantage of some of these specialty clinics on a space available basis.
That's great. And I could see where a care navigator that specializes in veterans benefits would be crucial here in a private duty organization to help navigate some of this, because I dare say a lot of people don't know that they can access this.
Even veterans, even in your metropolitan areas, probably are not aware that they could go to an optometrist and get an eye exam, which, as you know, then could lead to other things. So a lot of these specialty clinics, I think there's just a general lack of awareness, and a person that was skilled or knowledgeable in veterans services in the local area would certainly be a valuable advisor to the family.
Great, thank you. You've got my wheels turning now. There's a lot of things that we could certainly do in private duty for this. Colonel Ross, is there a funding source that would actually directly pay for private duty?
Well, funny enough, in addition to the pension program I mentioned earlier, there's these couple of add-on things that can be done as well. One of them is called the VA aid and attendance benefits and housebound allowance is the other half of that. Bottom line, the aid and attendance pension is called an enhanced pension, provides cash assistance to help in covering the cost of long-term care or private duty care. So again, if they're eligible for this, and if you notice, most of the qualifications very similar to the basic pension program. The fact the 90 days of active duty, at least one day in a wartime time period, and that also can be provided to them with funding to go along with that, in age 65 plus, all those kind of things. Basically, in this case, though, they're looking for non-service, it could be, like I said, non-service connected disabilities. Again, will be income driven. In this case, there's different tiers, the base, and there's what they call base plus housebound, and aid and attendance. And the aid and attendance is with needing assistance with at least two of those daily activities. So that's what they're trying to target on this. In this case, it can pay as much as up to $3,032 to the veteran per month for help with that type of assistance. And again, you got to remember, in this case, we're still talking on the pension level with aid and attendance. That's for those that are income strapped and disadvantaged in that area. And so that's going to be able to help them out a lot with this.
That's excellent. And as you were talking, I was just thinking that, as a private duty provider, we need to start making sure that we're collecting those kind of measurable performance measures with activities of daily living. Not that I'm definitely not saying go like Medicare does and do an OASIS, but we do need some standardized ways to document that person needs that assistance. So that's something that we can certainly do on our side.
Yeah, if I could add to that too, it's not only paid monthly, but it's tax-free is the other great thing about it. And according to the VA's papers, it says it can be used for any purpose such as home care, home modifications like stair lifts or walk-in tubs or assisted living. So it's a fairly broad areas that those funds can be used for.
That's excellent. Could go into that home maintenance piece that we were talking about and home adaptation.
Absolutely.
All right, we're going to move into hospice care, Colonel Rice, and kind of talk about the fact that 1 in 4 patients on hospice are veterans. And there's a We Honor Our Veterans program that many hospice organizations have signed up for. Can you talk to us about that?
Yeah, I'm really excited, and as a veteran, really humbled about the efforts that are ongoing in this area. It's really neat. As the hospice demands of this aging veteran population increase, the National Hospice and Palliative Care Organization has collaborated with the VA to create this We Honor Veterans program. The goal of this program is very simple, but it's very profound, and that is to care and honor those who have served when they reach the end of life. Many of these veterans are just unaware of hospice and palliative care options that are available to them. The We Honor Veterans program is really focused on educational tools and resources that promote these veteran-centric educational activities, increase organizational capabilities to serve veterans, and increase both the access and improve the quality of veteran care. The program also includes a tiered recognition program amongst its partners that demonstrate the systemic commitment to improving care for veterans. So by participating in these community partnerships and collaborations, these partner organizations are better able to educate, engage, and expand awareness of these end-of-life services and benefits available to both veterans and their families.
My father actually is as I said, a Vietnam veteran, and he was on hospice care. And we actually have volunteers that came that was veterans to actually, talk with them. And it's amazing, even in a very late stage of dementia, how veterans recognize veterans, right? They know them when they come in. And a simple thing like giving my mom an American flag and my dad a pin for his lapel was part of their We Honor the Veterans program. And so it just made the world a difference to them, put a smile on their face. And that was something my dad wasn't doing much of in those days, so smiling. So it's a very worthwhile program. And our National Hospice and Palliative Care organization is part of that, along with the VA. So I think any kind of private duty agency that would, kind of look at that website and start modeling that would be way, way ahead of the game, right?
Well, and not only that, but, it probably makes a lot of sense that if you're a family member or a caregiver of a veteran, or even the veteran itself, and you're trying to sort through these different hospice and palliative care options, and you come across a company that proudly identifies itself as a We Honor Veterans company, that's gonna have a lot of credibility. That's gonna have a lot of, they're gonna instantly feel more comfortable or more drawn to an organization that recognizes that their needs might be slightly different, or that they have an appreciation for the culture and the benefits that they have. I think right away, that is comforting to both veterans and their families.
Thank you. Excellent. Is there any end-of-life benefits that's available to veterans that we should know about?
Yeah, you get to this point, right, where the veteran is at the end of life, and both the veteran and a surviving spouse or a caregiver has been focused on care, and when it gets to the very end of life, they just may not know that there are some benefits out there that will aid the family as they transition financially. So it's sort of a final act of tribute for those who have put their lives in harm's way for our country. The VA does provide a variety of burial and memorial allowances. Eligible veterans are authorized to be buried in one of 138 different national cemeteries, and include many associated burial expenses, such as headstones and funeral honors. Ongoing death benefits may be paid to family members based on eligibility requirements. But again, many veterans and immediate family members may not be aware that these programs exist. And in some cases, these are retroactive reimbursement for which there's paperwork and things like that involved that could be, a source of financial aid to a family that if they don't know about, they would know.
You just said something that eligible family members may continue to receive benefits. What I see often when we're looking at chronic diseases is that the spouse often deteriorates in health as well. And sometimes in private duty, we're caring for both people, both the married couples. And so knowing that there's a funding source still available for that spouse is huge. I would imagine that would take a huge burden off of these families.
Yeah, and again, exactly like you say, it may not be a case that they were never told or weren't aware, but the other spouse may be in such need of care themselves, that they're unable to recognize that or to take the action needed to take advantage of some of these programs. And it's quite possible that their children or family member that are providing care, sort of being one step removed, may not know. So it's a great opportunity to help provide what could be some valuable information to the family. Excellent.
Colonel Ross, anything to add?
Yeah, just one thing. I talked about the pension programs and the 3-tier pension program. There's also a survivor's pension. And so that's one of the things we'll talk about in a little bit too. So that's another thing that's going to help them out. If they're veteran qualified, then that spouse may be able to receive that as well for the rest of their life.
Sitting here talking to you two gentlemen, what makes me think if I was out there, I would have a veteran coordinator position made by tomorrow. Have that job description written. Respite relief. We talk about respite relief. Can you tell me a little bit about that, Colonel Ross? Is that where you kind of know a little bit more in depth about?
I do. Yeah, this is very interesting. There's a lot of great organizations out there to help veterans. One of those is the Elizabeth Dole Foundation, former congressman as well as wife of Senator Robert Dole. And she established several years ago a program to assist veterans. And one of the things they have come out with is a respite relief for caregivers where they're donating 24 hours of relief. They asked for volunteer organizations to support that. They started off in a couple of locations, a couple of states, and they just recently took this nationwide. So now this is, and again, it's one of those that you can go on the Elizabeth Dole Foundation website, listed at the bottom of the slide, and you can look and apply for it there. The families can apply for this help. And again, it's for the caregiver. So it's somebody to come in, provide some private duty to allow them to have some time off to help these caregivers that are stressed to the end. And right now they're using, one of the organizations donating time is CareLinks, providing bathing, exercising, cooking, all those kind of things that private duty would help out with. They're in partnership with Wounded Warriors, with AARP, and of course the VA themselves in this effort. And right currently, as I got about a week ago, there's about 72,000 hours have been donated so far to this program to go across the nation. So again, in recognition that, as we've been talking, that the caregivers, the family and the spouses, it's a drain on them as well in their health, and this is a relief and a little bit of respite for them.
So when you send me the slide deck and the link, I actually went on here. So for our private duty agencies out there, you can go on and register yourself as a private duty agency and your individual caregiver. So you can go register your caregivers. So when these donations come in, your caregivers are going to pop up. The CareLinks is actually a connection, like a technology platform that's connecting caregivers with those that need the care. So as a private duty agency, I would encourage you to go on and put all your caregivers on there that's willing to work with the veterans. And I would say, make sure you do some cultural awareness with them. Make sure you do some training with them before you register them on this program. Great resources that Colonel Rice provided on We Honor Our Veterans. They can go on that link and learn the specifics about caring for veterans. But again, 24 hours may not seem like a lot, but if you're living in a city like San Antonio, like all of us live in, Military City, USA, there's a lot of veterans out there that's needing care. So other considerations, there's some other things out there, Colonel Rice, like Survivors Benefit Plan and lots of other things. Can you talk to us about that?
Yeah, so, we talked a little bit, under end of life, but, as the veteran starts to get towards the end of life and the surviving spouse, the veteran starts to want to make sure that the surviving spouse is taken care of. The surviving spouse wants to make sure that their financial needs are met. There are financial programs for which survivors of deceased veterans may receive compensation apart from anything that's done privately. Now, while military pay, retired military pay, stops upon the death of the retiree, if the retiree elected to participate in the survivor benefit plan, this program provides a continuous life annuity for its designated dependents, which is usually a surviving spouse. Colonel Ross also talked briefly about the Survivor's Pension Program. This program will provide monthly payments to qualified surviving spouses and unmarried dependent children of veterans that served during wartime. But again, this is a need-based program, so there are certain congressional income and net worth limits that are required to become eligible for those survivors' pension. Additionally, the VA offers and facilitates a suite of life insurance programs on behalf of both active duty service members and veterans. The Service Members Group Life Insurance Program, or SIGLI as it's called, is a term life insurance program managed by the VA that is applicable to active duty service members, but it is automatically extended for 120 days after their service. So it gives a service member the opportunity to transition to a private life insurance if they want to, but it keeps them protected for up to $400,000. And service members that are covered by SIGLI, if they happen to suffer a severe injury while they are on active duty, particularly during wartime, so we think of the IED blasts, the head trauma, the loss of limb, loss of eyesight. If they suffer those while they're on active duty and they're covered by SIGLI, they also qualify for short-term financial support through the T-SIGLI program or the traumatic SIGLI program. And that can also be a source of additional funds to deal with some pretty severe injuries. Once the veteran leaves the service, Congress created this program to make sure that veterans would still have an opportunity to have life insurance beyond their active duty service. And so the VA operates the Veterans Group Life Insurance Program, which is very similar to the SGLI program, very similar to SIGLI. But when veterans leave active duty, they have up to 1 year and 120 days from when they leave the military to qualify for this life insurance with no medical examination required. Their acceptance is guaranteed. And again, similar to the SGLI, these coverages can be up to $400,000. So if a veteran has taken advantage of that program, that is certainly not an insignificant amount of money to help take care of his surviving family members.
Excellent. And I still keep going back to that spouse. I love the picture here because oftentimes that's what we see. One spouse passes away and 6 months later you lose the other spouse. And many times it's because, that has been their total commitment is into the care of caring for that spouse. So knowing, I think if I was a veteran and I was on hospice, knowing that my spouse had that funding source available for their care afterwards would be huge. And something that would, again, a care coordinator, a veterans coordinator through private duty could navigate that with them and discuss with them. So marketing, I want to just mention this. This is the top 10 areas that our veterans live. They like to live in places everybody else likes to live in, with one little caveat. We like it warm when we get older, but we also like not to have to pay that state income tax, right? And maybe even property taxes. So you'll see those states that are very friendly to our veterans and in forms of no state income taxes being listed in the top 10. There's really not a big shift. Texas and California kind of jockey around a little bit there. But in 2030, you'll see a couple of new states coming on board, which is New York and Washington as the top 10 states emerge for veterans. I put this out there for our private duty organizations because I know we have a lot of listeners in Texas, Florida, and California listening to us now. You guys are right to market to our veterans. All right, so we're going to start this marketing program. We see that there's a huge benefit. Can you guys talk to me a little bit about patient considerations and staff considerations? Colonel Ross, I'll give you the patient considerations and Colonel Rice, the staff.
Yes, when you're dealing with the veterans, just about every veteran to some degree, especially if they've had wartime combat experience, they're going to suffer from anxiety. I served in Iraq, Colonel Rice served in Afghanistan, and even if you come through it what you think relatively unscathed, there's going to be a certain amount of anxiety. You're not comfortable in a crowd. So just things to think about when you're working with the veterans. There's a large incidence of depression. Obviously, suicide rates have been pretty high, and you hear different numbers, but at least usually double the normal population. So they're dealing with those kind of issues. They have post-traumatic stress disorder, so that has to be dealt with. So sometimes they can react differently to stress than what somebody normally would do. And oftentimes, maybe they came into service through one of our territories or from another country. So a lot of time English is a second language. So then again, that's going to be something that has to be considered. And I know that's part of normal home care anyway, but with the military, you're going to find that as well.
Excellent. And I think I read somewhere that minority veterans are about a third now. They're actually growing. So what about staffing, as he talked about some of those patient considerations, Colonel Rice?
Yeah, it's helpful, I think, for caregivers to have some awareness of the traditional culture that most of these veterans experienced, both during and after their active service. There are a lot of stereotypes out there about the military folks and the military lifestyle, and in a lot of cases, there's a lot of truth to that. And so I think having a respectful appreciation for that caregiver will help those caregivers more easily form bonds with their veteran patients. For example, military service is very highly structured. So the first bullet there talks about punctuality. To a veteran, most veterans, if it's a 10 o'clock appointment, that's a 10 o'clock appointment. That's not a 10:05 or a 10:15 or a 9:45 appointment. That's a 10 o'clock appointment. And that's kind of the way they think. Respectful. Obviously, the military organization is sort of organized by tiers of rank and tiers of respect. But even in the civilian world, don't be surprised if a veteran who may be 30, 40 years older than you is still going to refer to you as sir or ma'am. And that's done as a respectful gesture, as a polite gesture. It's not meant to demean or denigrate anybody who happens to be younger than them. So I think there are a lot of things that a caregiver can be sensitive toward that will help them get off to that right foot with a veteran who may be a little anxious about having a caregiver in their home.
Excellent. And I know I experienced that with my dad. When they referred to him by his rank, Major Dixon, then he set up and he listened better. It's like it was that instant camaraderie that's there with our veterans. So I want to thank both of you guys. This has been incredibly informative, even to me as a spouse of a veteran. I have learned things from this, and I've certainly learned ways that we can actually help in our private duty industry. I hope our audience has too. I hope there's questions just spinning in everybody's mind now about how we can go out and service this population group. If you do have questions, feel free to email me at tross@axxess.com. There's actually my email address on there. I'll be happy to answer that for you. If I don't know, I'll get with one of our two guests and I'll get you those answers. So thank you very much. And with that, I'll turn it over to Samantha.
Thank you, Tammy. And thank you all for sharing all of this wonderful information with everybody today. Everyone on the call, don't forget we will be providing a link to the slides. There's also the handout in the slide on the webinar screen. And we will be sending out a follow-up email with a recording of the webinar as well. And you can always access it on our website, axxess.com. So thank you for joining us today and have a great rest of your afternoon.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.